I chose the Doctor of Medical Science degree here at LMU because it showed more of a clinical path. It focused strictly on the medicine. It was taught all by physicians, taking you from after graduating PA school, having years of experience, and then taking you to that next step, next level of your own clinical practice. I think the most beneficial piece to the DMS program here at LMU was the physician-led instructions. You had both radiology taught by a radiologist, you had anatomy taught by an anatomist, and you had specialists teaching each individual organ system. And at each time, they were easily approachable. It was great to intermingle between your colleagues and classmates that were from across the United States. So you got different perspectives. So the hands-on ultrasound training was top-notch. The radiologist has not only radiology experience, but interventional radiology. And he was able to show you ways to not only do the ultrasound itself, but interpret it and be able to apply it right away to your patients. Whether you're in emergency medicine, whether you're in a primary care office or rural medicine, whether you're in a subspecialty, whether it's orthopedics or like myself in urology, you're able to take that skill that you just learned and was taught and apply it today. The program at LMU really, by the way it was taught and the way you focus on breaking down each individual patient, has increased my confidence in those most difficult patients. Before, you may have gone straight to your supervising physician right away, not having the confidence of what the next part of the workup is. By the way the training was placed in the DMS program, it allowed you that confidence and ability to say, okay, I recognize something early on, get the advanced studies that were needed to make a critical diagnosis. If I would have had a question from other PAs, and we get this all the time, which doctorate program would you recommend? I would definitely hands down recommend LMU's DMS program. The reason being, it's mostly clinically focused. A lot of other programs, whether it's Doctor of Medical Science and so forth, they're out there. The difference is they're not as clinically based, and it's not all taught by physicians. The best part about LMU's DMS program is it is taught by physicians. It is very clinically based, and you come out, hands down, a better clinician.